In my country, we went to so many hospitals. They said they promised to do the surgery, but my heart doesn't accept it. So I feel that they cannot do it well. The doctors, the first doctor I met, he told me that he couldn't do it. Then he referred me to one of another hospital in this India. So when we go there, the man said the same thing, that he cannot handle the surgery for the fear of infection. So, but when we came to this Wockhardt, the doctor there said that he can do it. So he had the surgery on 28th of last month. So just like that, by grace of God, after 2 days, the physiotherapists took place, started their own work. And in the hospital, my experience is that everybody takes good care of his work. They are not joking with their work. Doctors, nurses, physiotherapists, everybody, all the sections, they are very capable. They work hard to see that they deliver very well.
Today we have a very, very interesting case that I would like to discuss with you. This is with regards to John, a gentleman who presented to us with a very, very bad knee, a knee that got bad after he sustained a bullet injury around about 18 years ago. So as we can see, this is an X-ray of both his knee joints. This is his right knee and this is his left knee. Now what we see here is the bullet that had penetrated into his left knee, which is still lying there. They are absolutely ill-defined and very rough and irregular on the left side. We can see that this knee is not performing the job that it needs to perform. The cartilage between the two bones is completely worn out, and he's got significant degree of arthritis in the left knee. However, at many other places he was counseled to have a procedure known as arthrodesis, which essentially means to fuse the knee rather than giving him a functional knee. Both of us decided that we were willing to take the risk and go ahead and perform a complex knee replacement surgery to give him a good functional outcome. The surgery went uneventful. We had a good recovery. He was up and about from the first day post the surgery. We allowed him to bend the knee, straighten the knee right from the day of surgery. He had an uneventful recovery overall. He was walking with the help of a walker from day one, left the walker within a few days of surgery, and today he has come for a follow-up just before he's traveling back home.
The experience has been nice. From the airport to the hotel where we stayed, moving from hospital to hospital, and then finally we got here. Our encounter with the doctors has been nice, and it has been informative as well. I would like to say they are very detailed in everything they did. The attention afterwards, because that's the most important thing, was good, so it has been good as well. And his recovery rate is very fast, and it's very obvious how good the procedure is.